So let's talk about like the pregnancy and childbirth. We talked about a little bit earlier, but like as early as 12 weeks, that fetus is heavy enough to be like pushing down and putting excessive pressure on that pelvic floor. So people, the back pain so common, the hip and groin, the bladder leakage, the sciatica pain, all those things are really common. And sometimes you can't prevent it, even when you have your fascia blasting and you have good posture. Our hips are going to change into that anterior pelvic tilt to make room for the baby. So our alignment has to shift for pregnancy.
Right.
So we're going to be a little off, but there's a lot we can do to help either prevent it or reduce our symptoms, right? And so even pregnant women can do the challenge because pelvic floor is anytime, fascia is anytime. And fascia blasting while pregnant is a little bit different. So can you talk a little bit about that for everybody?
So, I'm the product manufacturer. So I'm always like, this is contraindicated. This is contraindicated because I don't want people suing me. And sadly, pregnancy is one of those things where, anything that happens, people are looking for, like what caused this. But a couple of years ago, I was like, I just can't keep that contraindicated because if I was pregnant, honey, I would be getting my blast on every single minute of the day. It is so good for the body, pregnant or not. I even, for a while we were like, okay, just don't blast on the belly. But the reality is like we have, to me, it's no different than a prenatal massage,
Yeah.
and you're in control of the device. So if it feels good, then it probably is good. And
I think, listen to your body. I think that's the biggest thing is when people complain or say, oh, there's an issue with something, they were not listening to their body, right? You have to honor your body. If there's something is uncomfortable or hurting you, listen, that's your fault for not listening. And just honor that, right? Listen to your body, what feels good. You don't have to overdo stuff, and just really bringing it back. Even with the exercises, I don't tell someone how many reps to do. Like when I give people programs, they love a reps, but I'm like, no, I'm like perfect form as perfect as possible. And that's actually why I don't have tons and tons of videos, like 300 videos in there. You don't need that. You want as perfect form as you can in a relaxed state so your body's responsive and flows. And then you start advancing, like maybe speed, you add a little weight, and you add advancements, but you have to listen.
I feel that same way about fascia blasting. I mean, I feel like, we have the smallest little clawed tools here, right? And these are in the packages. So if I'm using this at the skin level, that's my test. Does that feel good? Is it naturally going in a little bit deeper, or is my skin and my surface fascia fighting that? If it is, then we stay surface. Surface blasting, super light like this, is amazing for the body. It's not going to completely restore the fascia, but it's still amazing. You're still circulating the blood. Anybody who is having issue with like this, swollen legs during pregnancy, it helps with the venous return. It is amazing for the lymphatic system. We are like, that technique is like dry brushing on crack for the lymphatic system. And then if it feels good, you'll know. It feels good. It feels like
that little onion, layer by layer, right? So that's why I'm so glad you said that about the light. It's about listening to your body. If that's what your body's wanting right now and deeper's not comfortable, go light. And I know with time you can get deeper and deeper, with time, but that's just listening. You don't have to go full force if your body doesn't want that.
Yeah. And if you're brand new to fascia blasting, you have to understand that fascia does restore layer by layer by layer. For instance, so if this is the whole thing, right? So if all of this is tight, if we start trying to ram down into this tissue, it's just not going to let us, and it's going to hurt, and it's going to bruise. But if we really need the deep work down here, and we open this layer, and then we open this layer, and then we open this layer, that deep layer will be available to you.
Yeah.
But that's when you have to, I love back in the PT days where, we had like the R1 resistance. That's what I've been teaching in my academy is like, go to, like if you were a trampoline, right? And you touch your tissue and you now feel the trampoline. You just feel it, it's there. So push into your body till you feel the top of the trampoline, blast there. Now, if your trampoline lets you go all the way, then for sure, go for it. And it's not going to be painful. It's going to feel amazing. It's going to be like what you fantasize about your whole life, you
Oh
know?
my gosh, I feel so good after I blast. And my daughter loves me to blast. I blast both my kids. And I really see what you're saying, especially with my daughter, because when she sees me doing it, I bring out all the tools. I put a towel down and I'll do it when I hang out with her. And then she'll be like, Mom, get me, get me. I'm always like, yeah, when I'm done with my legs, I'll get you. Just wait for me.
It's really
But
beautiful though, Courtney, that you do that, because obviously I treated my kids and they used blasters, and my son is 28 years old. He's married. He's living in Singapore, and he calls me yesterday and he's like, Mom, my boss, she's got this. I said, why are you asking me? Get the mini too, go for it. And he sent me a text 30 minutes later. He's like, okay, all of her symptoms are gone. And she had been struggling with this climbing injury for 6 months. And it's great because my kids are so empowered. So all the moms out there, like, don't be scared to use even a baby. I'm talking lightly on their back. Like, I don't have any problem. I don't have any contraindication for using it on children. I just say use mother's discretion, right?
Several years. And my kids do the pelvic floor or different ball exercises with me too. So your kids can join you. And my daughter loves the fascia. She was having some wrist problems. She does dance now. She used to do competitive gymnastics. And her wrist, yeah. And so of course I was doing like the wrist, the forearm, and it just went away within like 1 or 2 blasts. It was like, Mom, it's gone. And you know why I love that for kids is then they understand the power of like tools and exercises and that, wow, I can truly change how I feel from some simple things. And I think it's really powerful because they grow up and we're modeling for our kids. And that's why as moms too, how we talk about our bodies and what we demonstrate is just so important, even for young boys, but especially for young girls. You know how moms talk, and this is kind of a little off topic, but when I hear moms like, I'm fat, I need to lose weight, I'm on a diet, it breaks my heart. Don't say that. It's all about being healthy and food, and you want your brain to work well, you want to function well. And so if you're a mom out there, the way you talk about your body in front of your children, and even when you think they're not listening, it does impact them so greatly. So I just had to say that because I hear so many moms say stuff.
I co-sign. Yeah. I grew up with a mom who, if you didn't have money and you were skinny, and I mean actually the word skinny, then there just wasn't much value.
Yeah,
you know?
It's so sad.
And then those things, penetrate into your life, and you have to, as an adult, take control and go, wait a minute, this is a limiting belief or like a thinking error, so you can save that with your children. And the reality is that if we're focused on healthy choices across the board, our body is going to be, lean, supple, not shredded. That look is for people who go the extra mile. But I mean, just making healthy choices, you're going to have a healthy body, no one ever has to.
I always think that too. I feel like when people have your goal should be something like aesthetic looking, right? Like I want to feel better. I want better posture. The aesthetics come and you're going to look how you're like supposed to be, how God made you. Like women are sexy and beautiful and we come in different shapes and different curves, and that's a beautiful thing. We don't have to like fight that, and become so obsessed. We want to feel good.
How do you feel, Courtney? I'm so curious about like just the whole idea of a completely flat stomach. I'd never really thought about this until I got older, and it's like, doesn't our womb need that? Don't we have a little curve there?
You do. So I'll sometimes put stuff up like flat tummy because people like to hear it, but there's this curve, like women are curvy,
but
right?
Even flat has curve, right?
Yeah. So I actually don't love, like, I don't think you love it either, that like super overly shredded look. It's typically not as healthy, right? Like they're really tight and rigid. I like sexy curves on women, and they come in all different shapes, like some of us are a little thinner naturally and have maybe a flatter stomach, but yeah, like we have organs, we have a moving side of it. We're gonna have curves, and I think it's a beautiful thing. We live in a society with quick fix. That's actually with the tightening too, like the Mona Lisa laser. I am not a fan of those. I've had OBGYNs reach out to me who need to refer people after because they know it's not a long-term solution, and it's actually tightens tissue, which you and I were already talking about tightening
Could
tissue.
or could not be a good thing. You know, if you're tightening it by causing micro adhesions, that's not good. But if you're taking it from a thick, less hydrated state, like when we see, you know, the turkey neck and things like that, where the skin is not doing well, it's because fascia also feeds the cells. So if we are tightening via restoration of the collagen matrix below the skin, I'm all for it. But there are things out there that are intentionally zapping the fascia to get micro adhesions. And
and that's what concerns me. So I'm like, there's a better way,
scary.
you know, and it's so expensive. And I'm just like, why didn't you actually take care of the issue? It's like that Band-Aid approach, you know. I'm like, if you think about if there was a device we could put on our body to have strong, toned, supple muscles that are elastic and fascia, that's what people want. It's just, that's not how our bodies work, right? We have to put it through good movement patterns. We have to do the fascial work. You know, that's
right.
just, that's what we need to do. It's just a little bit of time makes such a difference.